So this is my healthcare diversity project. And I'll just start it up quick. So meet the interviewee. I interviewed my friend from high school. His name's Oscar Nesland. He's a male, 19 years old right now. He's white. He's from Norway. He was a foreign exchange student. And his religion is Christianity. He is the Mormon branch, which we don't have a lot of in this area. And he goes to BYU in Utah. So a little bit about him, just some backstory. Oscar grew up in Norway for the first 16 years of his life. At the age of 17, he spent a year in the U.S. as a foreign exchange student in Wisconsin. He lived with one of my friends. That's how we met. After completing his year as a foreign exchange student in Wisconsin, he moved back to Norway to complete his last year of school. In 2024, he was accepted into and enrolled at Brigham Young University in Utah, and he remains in Utah currently continuing his secondary education. So the big thing I'm focusing on with him for diversity, I mean, obviously he's white, he's male. There's not a lot different about us other than the fact that he grew up in Norway and he has a lot of experience with a different kind of healthcare system. He's accustomed to completely different things. Maybe they have different ways of going about things. I know they use the universal healthcare system over there. So just, it's completely new to him over here, what he experiences healthcare-wise. So in the interview I did, which will be included at the end of this video, you can skip to the end of the slideshow presentation, and I think the interview lasted about 14-ish minutes. So if you want to know where I'm getting this information, you can listen to the interview there. He stated that the healthcare in the United States is a faster process, although it feels very disorganized and unnecessarily repetitive. What he means by that is that the healthcare information in Norway is public, so when he goes in there, he said they just know everything about him. He goes in, he sits down in the waiting room for like 5 minutes, and they bring him in. In contrast to the United States, where a lot of times they sit you down in the waiting room, you have to fill out how many questionnaires, you go in to see the doctor, and they ask you these same sets of questions every time, even though it seems like you've been asked them a million times and the answer would not have changed. So he says even with that kind of clunky and weird process that he's not accustomed to over in Norway, the United States still seems faster. Financial decisions. So obviously, like I said, he grew up with the universal healthcare system in Norway, where there's no direct cost to anyone for a health-related visit or treatment. I questioned him quite a bit about this, as you'll hear in the interview if you listen, and he had a lot to say. He said he definitely prefers the universal healthcare system, but in the short time he's been in America, probably about 2 total years now, he's already avoided going to the hospital to avoid a hospital bill. In his case, the injury he avoided the hospital for may have long-lasting effects. He said he obviously didn't know it at the time because he didn't go to the hospital for it, but he was having some pain in his back from lifting weights while he was in high school with us. And eventually found out that I think he said he tore a disc in his back, and that can have some lasting effects. He still says he has to rehab his back, and it feels like putting weight on his left leg. It feels a bit weaker and unsecure. And he said, in contrast to Norway's healthcare system, he stated he would have gone to the hospital same day for the injury. So you can tell he knew it was an injury that was worth going in for if he were in Norway and if that visit was going to be free. But because he was in the United States, he avoided going and now may have long-lasting effects from it. And then I questioned him further on it, and he said even knowing that there's going to be these long-term effects, which may not be the most severe, but they're there, and they could get worse with time, and he knows that, he still would have made the same decision to forego medical care, which kind of just shows you that growing up in that culture where they get that free medical care, it's going to have some long-lasting effects while he's here in the U.S. because maybe he feels he's just not used to paying for his medical care through insurance or however it is. He's just not used to it, and maybe that makes him less prone to doing so. Some assessment factors that I asked him about. He said that healthcare-related questions do not make him uncomfortable, and that he would be willing to answer any questions asked. He understands the professionalism in healthcare and that questions are asked for a reason, even going as far as saying that he would share all information with his father. His father is a doctor in Norway, so he's very open to this stuff. He's very open about it. He has some understanding about how the healthcare system works from his father, but I just thought the fact that a lot of us let our pride get in the way and we wouldn't tell our parents something that's going on, even if they were a doctor, and even if, pride can get in the way sometimes, but he said he's completely fine answering any and all questions about healthcare. Personal preferences in healthcare. I didn't ask him too much about this topic, but I did ask him the topic of male or female provider, which he would choose. He said that he trusts both male and female medical providers equally, but would rather have any assessment that includes his groin done by a member of the same sex, which is completely understandable. That's just personal comfort. I know that maybe there's some cultures in the world where females are kind of thought lesser of, maybe not as well equipped or trusted to provide medical care, and that's completely untrue, as we know, but he is not from a culture like that, I guess, or at least he himself does not perceive female doctors that way. The effect of religion on preferences in healthcare. As I said earlier, Oscar is Mormon. We don't have a lot of that in the area, but it still can be important to learn about just because it's kind of one of those things where if you don't know much about it and then you get kind of caught off guard with something. Luckily, for him at least, there's not any medical care that would be influenced by his religion. He stated that they have no significant effect on medical decisions that he would make. Mormons classify themselves as Christians. This means that they value many of the same beliefs as the rest of Christianity, of which is a large part of Wisconsin's makeup. And our branches of Christianity here in Wisconsin, very, very minimum effect on healthcare. Not often with Christian patients will you have them deny something because of religious reasons. Transportation options. He said that he has never had to ride in an ambulance and therefore he has not formed an opinion on transport choices. He did state that he has opted out of visiting the hospital for financial reasons before, as I talked about, making it seem reasonable that he would refuse transport for minor medical issues. This is kind of just putting two and two together. If he knew how much a ambulance ride would cost him, seeing as how he's already made the choice not to go into the hospital for a minor medical issue before, he would likely forego the ambulance ride, seeing it as unnecessary. That's not to say that for a major injury, he would likely choose to take the ambulance. Discrimination. He said that he has never faced discrimination in the United States healthcare system. It is worth noting that the region he currently lives in is predominantly white, with the largest concentration of Mormons living in Utah. So as far as picking a place in the United States for him to live, he picked probably the place where he fits in the best, where there's less discrimination to face. Whereas maybe if he went and lived in the South or on the East Coast or something, where there's not as many Mormons, or there's a larger diversity in the color of people's skin, maybe he would face some discrimination. I'm not sure, but living in Utah, being the religion that he is, and he's white, that's that's the majority of people out there. So he fits in pretty well. Uh, that and the fact that the only really hint that he's not from America is a very slight accent, which you'll hear if you listen to the interview. Um, it used to be stronger, but from his time living in America, I can personally tell you that it's kind of faded. Accessibility. He stated that one of his biggest issues with the United States healthcare system is its lack of integration with other countries. Uh, in the interview, he cited his glasses and contact lenses, uh, pretty much saying that although he has a prescription from a doctor in Norway for contact lenses, the United States healthcare system will not accept that prescription. They want to do their own tests. They want to verify everything and then write him a prescription in the US, which he seems as just a huge inconvenience because, I mean, it can be. He said he understands that for like maybe more effective drugs where maybe they could be sold or peddled. But for something as small as contact lenses where there's very little risk, I don't know what you could do with contact lenses. He seems it completely unnecessary to do their own eye exam just to come up with their own results. And he says even now he still doesn't have contact lenses. He still hasn't had that eye exam done. He's working with an old pair of glasses, of which are not the right prescription. And he said it's been a huge pain for him, especially with school, having to read and do all this stuff with his eyes not properly focused. Uh, Again, he said he doesn't understand why the majority of other countries are able to communicate prescriptions between them, but the U.S. is not. I think he phrased it as the U.S. doesn't trust other countries' doctors. I guess I'm not sure how true that is or isn't, but I know that a big part of it is the security risk. But again, for like these like contact lenses, I truly don't understand the point in just not honoring a prescription from a doctor, even if they are from another country. Again, that European Union, where they're all kind of close and packed in like that, maybe that makes it a lot easier. But I believe, I could be wrong here, but I believe Canada also honors those prescriptions, even though it's overseas. Um, yeah, it's kind of just, it is an understandable issue, especially for something as simple as contact lenses. And it can be for immigrants, people traveling to the United States to live here, if they have chronic healthcare issues and they need medication, say they run out when they travel to the US, they need new medication and they have to go through all these tests just to get re-diagnosed with the same exact thing. It can be a big pain. Again, he's not saying this for all these big high-risk drugs, but for some smaller ones that really aren't going to be sold or used illicitly, that it just doesn't make sense. Overview of the United States healthcare system. He stated that his view of the U.S. healthcare is suboptimal in every way. One factor he highlighted is the profit that is made off healthcare by inflating prices for medications or treatments that may be necessary for some. Again, he's from the universal healthcare system. He grew up there. It's what he's accustomed to. He doesn't have to pay for health insurance or anything like that, and he finds it kind of outrageous that we do have to here. He referenced the alterations in treatment that he believes some doctors make in order to receive a commission from drug companies. Yeah, I'm not 100% sure whether that is happening. It sounds completely possible, but altering someone's care in order to make a profit is pretty alarming. We are one of the only countries that allows advertising for drugs, which kind of just shows you how different we are from what he's accustomed to. The fact that We're one of only a handful of countries that allows that. Again, overview of U.S. healthcare. When asked what he would change about the U.S. healthcare system, he said that he'd like to eliminate the need for insurance companies. This again references his desire to lower the prices of medications and treatments, making it more similar, he said, not exactly like the universal healthcare system, but at least more similar, where there isn't this price gouging where people are paying for necessary medical treatments and being basically emptied out in order to pay for what they need. I mean, again, he grew up with that, not having to worry about that. So it makes sense that he have some desire to get to that point, as do a lot of people in the U.S. It's been a pretty major political issue for a while now. And that is the end of my presentation. Again, the interview will be right after this video. There is no video for it. I apologize, but like I said, he does live in Utah, so we had to do it over a voice chat. Thank you for listening. So my first disclaimer here, this conversation is being recorded. Are you okay with that?
Yeah.
All right, second disclaimer, the video will be posted publicly on YouTube for a short period of time. Are you okay with that?
Yes.
All right, so I'll start my questions here for you. First question is, what is your name?
My name is Oscar Nesland.
Perfect. What is your gender?
Male.
How old are you?
19.
Where did you grow up and where do you currently live?
I grew up in Norway. I'm in Utah right now because I go to school here.
All right, perfect. What is your religion?
Christian.
All right, and have you ever had mental health issues?
I don't know if you count ADHD. Yeah, not any like depression or anything like that.
Okay. Are you mentally or physically disabled in any way?
ADHD. I don't know.
All right.
I don't think that's disabled.
Yeah, I don't know. I'll figure it out for you. Don't worry.
You get to choose. Yeah.
All right. So this will be the start of the healthcare questions. Again, like however long you want your answers to be is whatever it is. All right.
Okay.
Okay. So the first question is: have you ever been to a hospital in the United States?
Yes.
All right. Have you ever been taken to the hospital or other destination in an ambulance?
No.
Okay.
I don't think so.
A lot of these questions will apply for here or your time in Europe.
Yep.
Okay. How would you compare medical treatment in the United States to medical treatment in Europe?
It goes faster in the U.S., but it also seems more unstructured in a way.
Okay.
I don't know. It feels like when I go to the hospital back home, the doctors already know everything about me because all the information's public. But in the U.S., they have to ask me like, "Oh, can you fill out this questionnaire? Oh, can you do this for me? Can you do this for me?" It's like, I don't want to do all that.
Okay, I gotcha. The next question is, does your religion affect medical decisions in any way? What I mean by that is,
What's it called? Jehovah's Witness, no blood transfusion.
Yes, exactly. Anything like that?
No.
All right. Are there any specific treatments that you would refuse for either religious or ethnic reasons?
I don't know. Not really.
Okay.
I don't think there's anything that I could do.
Okay. Yep. When being assessed by a healthcare provider, would you prefer them to be male or female? And is there any reason why, or is it kind of just like a comfort thing?
As long as it has nothing to do with my groin, I do not mind there being any females in the room. Like, I'm chill with, like, you got through med school. I didn't. I do not mind. You can do whatever you want. I trust you.
All right.
Like, unless it's with my pee-pee.
Okay.
And I'm not cool with that.
I gotcha. Yep. My next question is, are there any healthcare-related questions that would make you uncomfortable or that you would refuse to answer?
No, not really. It depends. If it was you asking, maybe, but like if it's a doctor, no, they should know everything.
So is
You know
so
what I mean?
is yeah, so is like as long as you don't know the person, as long as they're like some healthcare provider you've never met and you know it's for professional
Well,
reasons.
even if I, I'm comfortable, my dad's a doctor, and I'm comfortable telling him. Even I'm comfortable telling my aunt who's a doctor, because if they're a doctor, they got to be able to separate those things.
Okay, I gotcha. Um, in the United States healthcare system, have you ever felt discriminated against?
No, no, not really. Except once when I was like, "It's not really. Nah, it's just a joke, kind of."
Okay.
I was in for like I had to take the what's it called? Thing called the coughing thing.
Okay.
Cows can have tuberculosis. That's and then I said like, if you kill me, I'm going to kill myself. And then the doctor said like, that is very bad. You cannot say that. Like that is obviously a joke. And then she said crazy, crazy European. I'm like, bro, I didn't care though. It was just funny.
Okay.
She
Yeah,
didn't take my joke. That was what I was most offended by.
yeah. I gotcha.
Of
Um,
intelligence to med school, but not for a joke. It's crazy.
um, have you ever not received medical treatment to avoid discrimination or a hospital bill? I know, I correct me if I'm wrong, but Norway, you guys do the universal health care where it's all paid for pretty
Yes.
much. Yeah,
Uh,
so
there's no cost to you.
yep. So like in the US, have you ever like say like you'd twist an ankle or something and you would not go to the
Yeah,
ER to avoid
yeah,
paying a bill?
definitely. During my exchange year, I ended up tearing a disc in my back. I didn't know that at the time though, but I didn't go to the healthcare because I just didn't want to pay the bill because I thought like they're just gonna tell me like to like massage on my back and I'm not doing that,
Okay.
you
Yeah.
know. So I went back home and then they took a bunch of X-rays and I was like, oh, not cool. And I was like, oh,
Is that gonna have any lasting effect for you or is that kinda
uh, yes, in a way,
okay.
because technically like I have to retrain all of my back still,
Okay.
and I'm still like adapting to that. I guess I don't know. Like like my left leg still can't like handle my weight good
I gotcha.
compared to all right like
So now after that, knowing that that might have like some lasting effects for you, does that make you more willing to go to the ER for stuff now, or would you still kind of make that same decision if it were to happen again?
I would make the same decision
Okay.
because there's nothing they could as long as there's nothing like ripped and teared I can see hanging out of me like I'm not going
Okay.
because the amount of things they can do for me that I can't just wait like 3 months and do at home for free and then not being like dead forever is very little. They can just tell me to stretch this out, but I can just call anybody. Like I can call a physiotherapist and they're going to be able to tell me to stretch it out too.
Yeah, absolutely. Is it fair to say that say that were to have happened while you were back home in Norway, would you have gone in for it?
Yes, immediately,
Okay.
same day.
All right. I gotcha. Yep. My last couple questions here. What is your overall view of the United States healthcare system?
I think it is suboptimal, just in most ways.
Okay.
Just because there's everybody that is a doctor is like the fact they can earn commission on giving out medicine, and that is false. Has created like an opioid epidemic down in the south or something. And I don't mess with things like that. I don't think that you should be able to prescribe somebody an addictive medicine in order to get a higher commission from the state. It's kind of messed up.
Yeah, I gotcha. And then kind of just my last question, a follow up of that. Is there anything that comes to mind that you would change? Like any major changes to the system that you feel would make it better or more comfortable for you?
That's a hard thing because it would have to be. It would be like a nationwide thing. You know what I mean?
Yeah, no, absolutely. It's a difficult question. It's just kind of
There's
if there's anything like throw reason out of the window, obviously it would take like a big political movement but you have experience in Europe. Is there anything you would change? Like, are you more of a fan of the universal healthcare system, I'm guessing?
Yeah,
Yeah.
way fan. Or I would change the necessity and need for insurance. Because as of right now, the fact that insurance inflates every single price for everybody that doesn't have it is plain wrong. That's the one thing I would change, and that's a good way to start it.
Okay. Yeah.
Because it's not necessarily about universal healthcare, but it's about not inflating prices that are already unjust.
Yeah, absolutely. That was my last question for you. Do you have any other things you'd like to voice? Or, I mean, that was my last question, but if you have anything you'd like to state an opinion about the healthcare system,
Is there anything that would help you, like if I talked about, like,
um, I'm
for
gonna,
example, if your papers about like accessibility, I could say like, oh, like I can talk about how accessibility was in the U.S. or whatever.
yeah, I mean, absolutely. If you feel like there's something I missed, I have to hit like a 10 to 15 minute time limit on this. So with what I have right now, I could stretch it either way. But
Mm-hmm.
the more material give me, the better, you know?
Yeah. There is one more thing that I noticed. For example, I was trying to get glasses. Actually, like I have a prescription for US from Norway. I could bring the prescription here, and but when I bring it to the US, they don't think that our doctors are good enough, so they say you have to do it here, and that's kind of stupid because going across continents is not going to change how my vision works. Like if I can't see in Europe, I can't see here, and it's just kind of stupid because every single other nation is able to trust each other's doctors. Every single other nation uses uses a common way to talk about medicine and stuff. The U.S. is the only one that has like a different like type of way to speak about it, and it becomes kind of weird when you have everybody else trusts each other's doctors, but U.S. doesn't trust anybody's doctors. And it's kind of stupid because I'm just trying to get contact lenses. That's where I'm at. Like, if they just trusted me on it, what would it do? Oh no, I'm gonna like get addicted to contact lenses. That's doesn't work that way.
Okay,
You know what I mean?
so you're almost saying like better communication between the United States, and that way, like, for like immigrants like yourself, it would make it easier, number one, to migrate, but then to get
Mm-hmm.
like care for chronic issues and just make it more
Way
convenient and easier.
way easier because the thing is, it's not like something that's sensitive. It's not something you can get wrong. But the fact that I have to do it in the U.S. again because they don't trust the judgment is different. Because if you could buy results in the country and it's known for like corruptness, that is okay. Like, there's a difference between taking a security risk and just not trusting other doctors that you normally would trust. Like, we're trusted enough to trade with y'all, but we're not trusted enough to have our own medical fields. You know what I mean?
Yeah. No,
So
I completely get you.
it's kind of weird because there's just like a little weird like mishap there where that doesn't work, and there's no reason it shouldn't work because it's not sensitive. They said, oh, it's when I asked, they said it's like medical information. Nowhere else in the world is that medical information. You don't even do that at the doctors.
Yeah.
You take your vision test 2 places. It's private and in the military. That's the only 2 places you take it. So saying it's medical information is weird. It's like saying that my height is medical information. They need to recheck it when I tell them my height. Like, okay, sure thing, buddy. Like, you know what I mean?
Yeah, no, I get you.
It's
It's
not like somebody's gonna be able to track me down based on my eyesight. Just go in there and like inspect my eyeball and go like, yeah, no, this looks like this don't look right or whatever. I don't know.
yeah.
But that's one thing that annoyed me, and it's quite annoying because it's made it so I don't have contact lenses in the U.S. right now, so I gotta wear my glasses that are the wrong strength because I can't get glasses here without setting off like, hey, I would have to go into the U.S. medical system, and because I don't have a social security number, it is harder than what you'd think. Because who do I go to? I don't know. No one knows, and it's kind of stupid. But yeah, so that's just it's kind of annoying because I don't have contact lenses, which is something I would need in order to like do better in my classes and all that.
No, yeah, I get that. That's very helpful for me, actually. Thank you.